Hello everyone, we are here tonight. I Care for Your Brain, talking about sleep and memory. This is one of the most important topics that we all need to understand if we are going to take brain health seriously. Sleep is very, very interesting, something we spend over a third of our lives doing, but we really haven't had a handle on the function or the purpose of sleep up until very recently. So that's what we're going to talk about tonight. I am Dr. Karen Sullivan. I'm a board certified neuropsychologist and I practice here in North Carolina. We come to you once a week for about the last year and a half, talking about a variety of brain health topics, different brain health challenges, and mostly how it happens is people write in and tell me things that they want to hear about. So by all means, if you have something on your mind, let me know. And if I think I can contribute something helpful and meaningful, it would be my pleasure to do so. So tonight we're going to talk about sleep and memory. Sleep is, of course, a staple of our physical health, our mental health, and our cognitive health. It plays a huge role in memory, but maybe not in ways that you have ever heard before. So I always try to find things that are of interest to the general population, but also that will have a practical impact in how you take care of yourself. My big thing is information is power. And if there is something that I have come across that I think would genuinely contribute to your brain health, I want you to know about it. So sleep is so interesting, right? It happens in all sorts of different beings. So all the way from us, reptiles, birds, fishes, even bees and flies and cockroaches have this sleep-like states where they look like they're sleeping. You know, we can't quite measure brain waves in a little tiny flea like we might in an animal, but we certainly think that everything that they're doing is looking like sleep. Poor sleep hurts people's thinking, and in particular, it has a big impact on memory, and that's why we need to talk about it, because if your sleep isn't going well, and we need to define what well is, then maybe that's an area for intervention. It's something that maybe if you changed, if you knew better, then maybe your memory would improve, right? So this is really important if you are an older adult, so over the age of 65, or if you have had any type of brain health challenge, brain injury to stroke, to Parkinson's, to myasthenia gravis, right? Anything that happens with the brain, sleep is so important for you to know about. So there are 5 stages of sleep. We go from a very light sleep into a very deep sleep through 5 different sleep stages. And what the brain wants to do all night long is rotate through these different 5 stages over and over again seamlessly. It does not like to have the cycles interrupted. What's really concerning is that if when we fall into the deep sleep, and the certain functions that happen in deep sleep is what we're going to talk about tonight, and we get interrupted by things like sleep apnea, things like nightmares, the things that are more likely to happen when we are in REM sleep, so we are most relaxed, our pulmonary functioning is at its lowest. These are the times when people often get jerked out of sleep because of not breathing due to sleep apnea, or because of the nightmares, maybe related to post-traumatic stress or anxiety. And the problem is when you go back to sleep, you don't pick up where you left off. It all starts over again, and that takes actual time to work through the cycles to get back to the restorative deep REM sleep. So we've got the 5 different stages. The first one is just light sleep. This is where, you kind of starting to get a little bit drowsy, and maybe you get like a big muscle jerk, right? So you kind of know you're starting to go into the sleep phases. Then for about 45% of the night, we're in stage 2. This is where our breathing pattern and our heart rate slow down a little bit. We get a slight decrease in body temperature. And then we start to transition into the deeper stages of sleep. We have deep sleep, which is only about 4 to 5% of the nightly sleep time. This is when the brain really starts to slow down to generate the delta waves, the much more slower brain waves. And then we transition into REM sleep. So we have very deep sleep, which is kind of pre-REM, early REM. This is where we become paralyzed if our brainstem is working well and we aren't able to act out our dreams. When we can, that is something called REM sleep disorder, and that often happens in Parkinson's, Lewy body. But in REM sleep, this is where we have the rapid eye movement, right? That's what it's called. And this is when we get that paralysis. Your heart really starts to increase because your brain is actually very, very active. So even though there are these 5 distinct stages, the way brain scientists really think about it is they slice it and dice it by slow wave sleep and rapid eye movement sleep. So it's basically like REM sleep and non-REM sleep. And we do different things in these different phases of sleep throughout the night. And this is all driven by the circadian rhythm. You've probably heard of that before, right? So this is an approximate 24-hour cycle that all living things have. So not only people, but also plants and even moss on the trees has its own circadian rhythm. And really it's dictated by exposure to sunlight and the release of 2 different types of hormones, chemicals in the body and in the brain. First one is melatonin, right? So as exposure to sun actually goes down, then our melatonin starts to increase. This is what regulates a lot of the sleep cycle. It's what makes us feel sleepy and want to go to bed. When there is sunlight, or our brain thinks there is sunlight, this is when the melatonin gets suppressed and we get a lot of stress hormones like cortisol and adrenaline. This is what gives us the energy to start the day, to get out there and to get things done. So before modern times, this would have been a very naturally regulated cycle, right? When the sun goes up, you get the cortisol and the melatonin goes down. When the sun starts to go down, you start to produce more melatonin. The stress hormones go down. Well, we have successfully mucked this up with our exposure to handheld devices, and the blue light that comes out of things like iPhones and smart tablets very much mimics the sunlight to the parts of our brain that are interpreting different wavelengths, okay? So basically we get a false sense of sunlight and it's really screwed up our circadian rhythm. So we can get releases of stress hormone at night when we think we're doing something good, like playing solitaire on the iPad, and we're trying to fall asleep, but really the blue light from the device is actually telling our brain, cock-a-doodle-doo, it's time to get up and start your day. So I said at the beginning of the talk, what is the function of sleep? And really, brain scientists have just figured this out pretty recently. And really, it is a restorative process. So all the major restorative functions in the body. So this goes from muscle growth to tissue repair, protein synthesis, growth hormone release. All of this mostly occurs, and in some cases only occurs, during sleep. Okay, sleep is a biological necessity. We absolutely need it to survive. When people and animals are deprived of sleep for several weeks, their temperatures get really low, people tend to lose weight, and typically they can die from an infection or something like a tissue breakdown, some kind of a skin breakdown that gets infected. We think nowadays that the organ that needs the most restoration from sleep is the brain, and this is where our specific brain talk comes in tonight. So there is something during our waking hours that builds up in the brain, kind of like a waste product of thinking. So think about it like smoke coming from a fire. This is actually a chemical called adenosine, and this is really a byproduct of cells' activity. So this builds up in the brain throughout the day, and when it gets to be too high, reaches a certain critical mass or a threshold, this is why we get the feeling of being sleepy. So this is what people think neurofatigue is related to. If you've had a stroke or if you have some kind of a brain injury, you typically struggle with feeling very tired all the time. So not only is it that it takes more mental effort to get through your day and get things done, but your brain already has waste products in it as a consequence of the stroke or the TBI that it's already working on clearing out. So probably it doesn't take much adenosine in the brain to feel like it reaches critical mass, and the immune system wants to get in and clear it out. So when we're awake, it's accumulating. And when we go to sleep, this immune system actually breaks it down and gets rid of it. A lot of people think that the incomplete clearing of this chemical through poor sleep is what leads to inflammation, which is then what leads to the sensation of brain fog, which I think is fascinating. Our genes do play a role in how much of this waste product, adenosine, builds up in the brain. So this is probably why different people need different numbers of sleep each night. So you might know people, you might be one of these lucky people who feels like you can really do well on 6 to 7 hours. And then there's the rest of us who feel like if we could sleep 9 or 10 hours a night, we would be very happy. I am in that camp. One interesting thing to know is that caffeine blocks the chemical adenosine from building up. So this is one way that we self-regulate our alertness. Isn't that interesting? So how does memory tie into this? Well, first of all, we have to think about the value of memory, right? Memory is what really allows us to be successful in a changing environment. So this is the ability, to make and find memories is a really basic need. It really allows us to adapt to what the environment needs from us. So this is all the way from remembering where those ripe berries were at to which one of these people in my social group could potentially hurt me, right? I have to keep track of who's done what with who in order to think about what potential threat that person poses to me. So when we think about memory, we think about 3 distinct processes. So the first one is you have to learn it. We call this encoding. This is actually making the short-term memory. Then we have to consolidate it, or basically shape it over time till it becomes a more established longer-term memory. And then once it's a memory, we have to be able to find it, right? We have to retrieve it. We have to be able to access that file and pull the information out. So the most helpful way to think about sleep and memory is that we really sleep to learn, to remember, but maybe most interesting, to forget. If you think of all the things that happen to you throughout the course of a day, do you know how big our heads would have to be if you were to make a memory of every single thing? We would be very unattractive. It would not be pretty to look at a human being because our heads would be absolutely huge. During slow wave sleep, what we think the brain is doing is actually replaying the day's events and deciding what to keep and what to throw away. How interesting is that? So really there's kind of a note comparison that happens between one part of the brain called the hippocampus, which is our memory centers. We have one on each side of our brain, left and right. And what they're doing is they're showing these movies to the frontal cortex. The frontal cortex is where we already have some long-term memories stored. And what we're really doing is comparing the lessons that we learn throughout the day with what our basic beliefs, values, understandings are about the world. So a more straightforward way to say that is, we basically walk around with the belief like good things happen to good people. Or if I do something nice for someone else, that person should do something nice to me in return. So if you have something happen to you throughout the day that doesn't fit in with that story, that basic belief about life, there's a more intense comparison that happens, and your brain basically has to figure out, how does this discrepant, unusual piece of information fit in with what I think are the big themes, the givens that I believe about life? So a lot of times we think that that's what nightmares really are. It's a replaying, you disguise certain people's identity. They kind of look like this person, but they weren't really this person, because we're trying to find a sneaky way to get a memory to settle in to our big picture, long-term understanding of life and our social world and our relationships. So we do different types of memory review during different types of sleep. So in REM sleep, this is very important to know, this is really where we process the emotional things that happen to us during the day. This is why a lot of people think post-traumatic stress disorder is actually a sleep disorder, because what happens is people finally relax into REM sleep. This is when dreams come. This is when all that conflict comes. This is when we're processing the trauma, and it becomes so stressful, so anxiety provoking, that we basically break out into a sweat and wake up out of the deep sleep and have such a hard time getting back into REM that we never really get to reconcile or process the trauma. So think about sleep, deep sleep, like free therapy. It really is. This is that whole idea of, you've heard about Einstein sleeping on a problem, and he would go to sleep thinking about some type of issue that he had, and he would wake up and he would say he felt like he had been given the answer. It's because our brain is so active during REM sleep, problem solving and figuring things out. There's all sorts of behind the scene work that's happening. We also learn a lot about how to do new complex tasks while we're in REM sleep. So for example, if you're someone who's learning how to ski or practicing a piano, or learning a new game, when you are in REM sleep, your brain is literally playing those images over and over and over and over again to try to learn more efficient ways to get the task done. Isn't that amazing? When we are in slow wave sleep, we are reviewing a lot of motor memories. So what does this mean? This basically means how we moved throughout the world during the day. How did the connections between our body and our muscle and our brain do throughout the day? If there's anything unusual, the brain wants to review it in order to understand it, to master it. And we also have what we call perceptual memories, which is just kind of visually what we took in during the day. So the brain is super busy when we are sleeping. The way we think about memory formation is really in two different stages. So the first thing is that we put a memory, if we've paid good enough attention and we've learned it properly, we put it in one part of the brain. That's the hippocampus. Over time, the more we review it throughout the night's sleep, it actually gets stored in a different part of the brain called the cortex, okay? So the problem though is that if we don't sleep well and we're not reviewing things over and over, and we really only had one time to get something into memory, it's very vulnerable to interference. And so this is why eyewitness testimony has become so controversial, because if you just see something really, really quick and you don't hear it multiple times and it doesn't really fit in with your expectations, there's a lot of evidence that human memory is very prone to degrading and misremembering. So people who swear this person came in, this person came in with a blue sweatshirt. Well, sure enough, they find the person and the DNA proves it was them and it was a yellow sweatshirt. We can become very passionate about what we think we remember, but the truth is our one-time quick flashbulb memory is not actually that good. What memory really wants is that review from REM sleep over and over and over again so it can really make it more concrete. So when we don't get a good night's sleep, what happens? Well, our ability to learn new information drops by about 40%. We have a huge decline in our ability to focus, our ability to respond quickly. We make more memory mistakes. We're more impulsive. We're more prone to make a bad decision. But yet 50% of folks over the age of 65 report that their sleep is poor. So this is a big problem. We know that what's most important in a night's sleep is the number of continuous hours of sleep. So if I ask someone how many hours do you sleep and they tell me 8, sounds good on the surface, but when you actually get into it, well, they sleep for 3, then they're up to the bathroom, then they go back for 2, then they're up again to the bathroom, then they might get some water. So what you want to minimize are the breaks in sleep. Now, sometimes that's not always possible, and we're going to talk tonight about why that happens. If you fall back asleep quickly after you get up, that is much better than if it really disrupts you and you wind up being up for a half hour or an hour. Now, what you choose to do in that time also dictates how well you can get back to sleep and how disrupted you are. So that has to do with how much light you expose yourself to and how much stimulation that you give yourself during that time. So you don't want to turn on the iPad on full bright volume and go in there and do something like a card game that maybe it feels relaxing, but the truth is it's really much too much thinking. Reading something kind of boring by a dim little nightlight is much better, or actually just sitting there and thinking and relaxing and counting sheep. Those kind of things actually do work. So what we know is that there's 6 major things that happen as we get older that interrupt sleep, and then maybe about 10 or 15 other things. So the big 6 are sleep apnea, restless leg syndrome, anxiety, the impact of medications, alcohol breaking up the sleep cycle, and good old-fashioned insomnia. But also things like not having a good routine and when you go to sleep and wake up, chronic pain or physical discomfort, nature calling over and over again, drinking caffeine after about 3 p.m., hormone changes like menopause in women, all the hot flashes, having to get up, that blue light that can really hurt us in sleep. So let me tell you a little bit about medications. So there's a lot of medications that disrupt the sleep cycle, and I'm not saying to go off them. I'm saying become more aware so you can have an informed conversation with your medical provider. So a lot of medications for high blood pressure can interrupt sleep. So these are the calcium channel blockers, the beta blockers, a lot of corticosteroids. So this is treatment for arthritis or inflammation. A lot of inhalers for asthma or bronchitis. And part of what they do is they stimulate the central nervous system, and it just gets it more activated, making it harder to fall into sleep. Chemotherapy can interrupt people's sleep, and over-the-counter medication. So a lot of them contain caffeine, like glucosamine, so anything that says it helps with joint pain, not good. So how much sleep should we be getting a night? Well, sleep experts tell us there's no magic number, but most people need between 7 and 8 hours, and your goal is as much uninterrupted sleep as you can possibly get. How do you know if you're sleeping enough? It comes down to one pretty straightforward question, which is, are you sleepy? You should wake up most days feeling relatively refreshed, like you have pushed the refresh button. If you feel groggy, if you are yawning within a little bit of getting up, if you wake up feeling tired, chances are you are not getting enough sleep. You may be suffering from some kind of a sleep disorder, or something is going wrong. So one of the big things that happens in sleep that is concerning to me as a neuropsychologist is what people do to treat the sleep problem. So a lot of people turn to medication, and I want to educate you tonight about why that's not so smart as they first pass of a way to handle sleep problems. I'm actually going to ask you to use a 4-tier approach before you get to thinking about over-the-counter sleep meds or prescription sleep medication. So 1/3 of older adults actually take a sleep medication to help them sleep. And the problem is we don't even think they help that much, and they have very significant risks. So people who take benzodiazepines, this is like a Xanax or Klonopin or something to calm their body, they have a nearly 4-fold risk of falling and breaking a hip than people who don't take these medications. There's an increased risk over time of developing dementia. Ambien can cause a lot of confusion and is also known for a higher fall risk. Anything with a PM, the PM is Benadryl, which is basically an antihistamine, which has what we call anticholinergic properties. So the way memory medications work, most of them is they put the chemical choline into a person's brain, and that's like Aricept, donepezil, and it helps the person's memory. Anticholinergic drugs do the exact opposite. They take choline out of the brain, hence the name anticholinergic. Anything with a PM on it is hurting your memory. Please do not take it. People often ask me about the role of melatonin, and there actually is some scientific evidence that it will get you to sleep a little bit quicker and keep you to sleep a little bit longer, but not as much as you might think. The thing with melatonin is you want to take the lowest amount that you can possibly get. Do not have that feeling like more is better. The truth is less is more, so we advise 1 to 3 milligrams of melatonin about 1 to 2 hours before you want to go to sleep. But it is relatively new, so the truth is we don't really know the long-term impact, but most people feel like it's relatively safe. Remember I said I had a 4-tier approach for you tonight? The first thing you're going to do is try some good old-fashioned common sense, which we call sleep hygiene. And what this is trying to get yourself on a schedule. Try to go to sleep and wake up around the same time every night. You want to try to be consistent. You want to avoid late afternoon naps. If you want to take a nap, they advise you set your alarm and don't sleep more than an hour, and no naps after 3 p.m. You want to avoid the screens, that blue light, at least 2 hours before bed. Remember, this is stimulating the same part of the brain that sunlight does, and it sets off a whole chemical chain of events that actually makes you more alert, ready to go. You should not be eating or watching television in bed, much too stimulating. They advise to reduce non-essentials in the bedroom. How many of us have exercise equipment in the bedroom? They say that's a big no-no. Again, you want to create an environment of calm, and this is a place where you aren't getting too much fires coming at you at one time. They say do not lay in bed for more than a half hour if you can't fall asleep. You want to try to get up and do something without screens that is relaxing and distracting. You also should, of course, think about, are there emotional problems that I'm dealing with that only seem to hit me at night? Many of us deal with our anxiety by over busying ourselves, because it works in the short term and we can be distracted and throw ourselves into jobs and Facebook and all this stuff. But then your head hits the pillow and it's like your stressors hit you like a ton of bricks. So during your waking hours, you have to try to be problem solving. We try to have folks not drink too much liquid 2 to 3 hours before bed. And we encourage people to treat any underlying medical conditions that can exacerbate a sleep problem. So a lot of times if you have reflux or heartburn, if you lay down, that can happen a lot more. All that acid can kind of kick up and make you feel like you can't sleep that well. Diabetes, a lot of times people get night sweats, they have to urinate more, their body temperature is going up and down, the blood sugar, if it's unstable, is all over the place. That can impact sleep. A lot of people who have heart conditions can get more shortness of breath when they lay down because the body fluid is accumulating around the lungs. Arthritis pain can certainly interrupt sleep, and kidney disease, which makes you get up and have to go to the bathroom. So think about the common sense and the medical interventions first. If that doesn't work, then I want to encourage you to keep a sleep diary. So do this for 1 week and you're going to try to track, best of your knowledge, when you go to bed, when you get up, how many times you woke up, how you felt, what you did before bed, did you take naps, do you feel refreshed? Any piece of data that you can put in the sleep diary, this should help you figure out a pattern to the problem. If that still doesn't work, then you might want to consider technology. The sleep trackers that they have today are absolutely fascinating. They have a lot of them now for $20 and $30, and they will give you objective data about how much REM sleep you got, how much deep sleep you got, how much light sleep you got, how long it took you to fall asleep. These are the little bracelets you wear, and then it lights up on your smartphone and tells you you got up this many times. It took you this many minutes to fall back asleep. It's really, really, really interesting. And if that doesn't work, you can consider a sleep study. So this is all the steps you should do before you actually turn to meds for sleep, okay? If anyone's had a sleep study, feel free to chime in and tell us what that experience was like for you. It's mostly people say it's like going to a quasi hotel room to sleep, but it's in a doctor's office. Nobody's funnest night of their lives, but can give the doctors a great insight into what is getting disrupted in your sleep cycle and figure out if you have a sleep disorder. So many things that happen in brain health. The way people get better is when we have a personalized assessment, and then we make personalized brain health recommendations based on what we know is specifically happening to that person. I've said it before. Everyone's brain is different to begin with, so everyone's brain disorder is going to be expressed a little bit differently. No two strokes are the same. No two TBIs are the same. Really, no two Parkinson's are the same. Everybody is unique. And so your job is to get out there and advocate for the very best assessments that you can get, because that's what informs and drives the treatment recommendations. And that's how you're really going to identify all the layers that are going on with you and have the experts targeting each of the layers. So I think that stuff was super interesting and really helpful. Hopefully you thought the same. If you think this would help people in your life, or if you are on any Facebook support groups, I would really appreciate you sharing it. The more people that can know good quality scientific information about the brain, I think the less exploitation we're going to have, and the more we can empower people to advocate for themselves and their loved ones. I will be back next Wednesday night at 6 o'clock. Not quite sure what the topic is going to be. If you have something you'd like me to talk about, you can give me a message here on Facebook. I had a couple different suggestions over the last week, so I'm going to kind of sort through them and see which ones I think would be most helpful for the greatest group of people. But if you have an idea, definitely let me know. Thank you guys so much, and I'll see you next time. Bye-bye.